Good evening, all of you. Today's our topic is perioperative care. So we will start with our today's class of critical care medicine. So in perioperative care, we have the following objectives. We have objectives, introduction, what are the phases of perioperative care, what are types of surgeries, what are the category of surgeries based on urgency, surgical risk factors, preoperative preparations, what are the nursing diagnosis here, interventions of the nurses, post-operative care, nursing diagnosis and intervention post-operative period, and post-operative complications. So we have the objectives here. At the end of this lecture, the student should be able to differentiate between what are the phases of perioperative care, define the types and categories of surgery, identify the preoperative assessment, develop a preoperative teaching plan, identify surgical risk factors, describe the preoperative preparation, discuss assessment needed in immediate and later post-operative period, identify the post-operative complications. So what is meant by perioperative? So perioperative is a term used to describe the entire span of surgery, including what occurs before, during, and after the actual operation. So perioperative here is a term which is used to describe the entire span of surgery before the surgery, during the surgery, and after the actual operation. So what are the phases? We have perioperative, we have intraoperative, and we have post-operative. So in perioperative, it begins with the decision to perform surgery and continues until the client has reached the operating area. Then we have intraoperative, it includes the entire duration of surgical procedure until transfer of the client to the recovery area. Then we have post-operative, which begins with admission to the recovery area and continues until the client receives a follow-up evaluation at home or is discharged to a rehabilitation unit. So what are the types of surgeries here? We have the diagnostic one, removal and study of tissue to make a diagnosis, the pathology. Then we have exploratory, most extensive means to involve exploration of a body cavity or use of scopes inserted through small incision. Then we have curative one, removal or replacement of defective tissue to restore function, joint. Then we have palliative one, relief of symptoms or enhancement of function without cure, like thyroidectomy. Then we have cosmetic ones, correction of defects, improvement of appearance, or change to a physical feature. So we have emergency surgeries here, we have urgent surgeries here, we have required surgeries, elective surgeries, and optional surgeries. So in the assessment part, you can see we have client assessment varies depending on the urgency of the surgery, time for preoperative assessment, nursing diagnosis, evaluation of the nursing management, which may be limited when a client is admitted for ambulatory surgery or admitted shortly before the surgery. We have recognition of the client's immediate preoperative needs, which is important. When the client is admitted, the nurse review preoperative instructions such as diet restriction, script preparation to ensure the client has followed them. The nurse immediately notifies the surgeon that the client has not carried out a specific portion of the instruction. So what are these instructions? Normally, you don't have to eat 12 hours before the surgery. You have to maintain you have to take all your blood pressure medication, diabetes medication on time before the surgery or as advised by the doctor. So in the preoperative assessment, we have the review the preoperative laboratory and diagnostic studies, review the client's health history and preparation for surgery. You have to assess the physical needs, you have to assess the psychological needs, and you have to assess the cultural needs. So review the preoperative lab and diagnostic studies, the CBC complete blood count you can do, blood type and cross match, serum electrolytes, urine analysis, chest x-rays, electrocardiogram, other tests related to procedure or client medical conditions such as prothrombin time, partial thromboplastin time, blood urine nitrogen, creatinine, and other radiographic studies. You have to review the client's health history and preparation for the surgery, history of present illness and reason for surgery, past medical history, medical conditions, acute and chronic, previous hospitalization and surgeries, history of any past problem with anesthesia, allergies, present medications, substance use, alcohol, tobacco, street drugs, and review of systems. Then you have to assess the physical needs, ability to communicate, vital signs, level of consciousness, confusion, drowsiness, unresponsiveness, weight and height, skin integrity, ability to move or ambulate, level of exercise, prosthesis, and circulatory status. Then you have to assess psychological needs, emotional state, level of understanding of surgical procedure, pre-operative and post-operative instruction, coping strategies, support system, roles and responsibilities, assess the cultural needs, language need for interpreter.